Pharmacy is changing lives every day, and at FIP we celebrate people leading that change. We spoke to this year's award winners to hear about their work and the impact it's making for patients and the profession.
In 2014, FIP published a reference book about green pharmacy practice and what does it mean, and how to integrate sustainable principles to all pharmacy education, research and practice. And from that, we in Finland took that as our goal also, and we set up a project called Generation Green, where the green principles are integrated to all education, so that the young pharmacists, when they go through the school, the curriculum, in the end, they can take into their understanding all these principles in their daily practice. We have now the associate professor, the first one in the world for green pharmacy practice and sustainable pharmacy. So I'm very proud of many things which we have achieved together. And that's the strength also with FIP. You meet your colleagues and you plan together how to change the world and get the pharmacists the possibilities to adapt to and lead the change also.
The main focus for me in transforming pharmacy education is about developing the practice of pharmacy in Southeast Asian region countries. For example, let us take my country, India. We are well advanced in terms of industrial pharmacy and pharmaceutical sciences, but practice of pharmacy is an evolving thing and we are doing much better over the last 16 years. So my focus is in line with FIP goals that we take pharmacy to the patients to get better patient outcomes. So there are a lot of institutions in India as well as other regions where we started giving advanced training in one particular area based on the students' area of interest. For example, in our institution, St. Peter's Institute of Pharmaceutical Sciences, India, we train on infectious diseases, antimicrobial stewardships, oncology. So such kind of specialized training program is what we are trying to do and to lead the profession in the near future. So that is going to be the focus for transformation, that is going to be the focus for students. That is what will lead the profession as well.
Postgraduate Community Pharmacy curriculum is a two-year curriculum focused on training in the workplace combined with classroom-based courses, also some online courses. And we really wanted to ensure that it's fitted on the needs of pharmacy practice. And that's why we wanted to do an evidence-based curricular revision. And what we found was the key need was actually to support trainees and supervisors in the workplace, because training pharmacy is a great place to learn, but it's also very difficult to keep a focus on education while you're also making sure that you're delivering excellent pharmaceutical care. So an evidence-based approach to postgraduate education ensures that the education is really in line with what you want to have for results in pharmacy practice. So the pharmacists you train are fitted for pharmacy practice now, but also for the future.
The KNP is always working on a media strategy which emphasizes on being good and tell it. So we've always worked on the principle of basically show and tell to the general public what pharmacies do. With this particular video, we are showing the extraordinary lengths pharmacists will go through to actually get the medication to the public. We need to sometimes manufacture our own medication, call colleagues, call physicians, and sometimes get medication from another country. The bigger picture is always to get people to know what your pharmacist does for you behind the counter and what pharmacists can contribute to the general healthcare. With this video, especially around shortages, we want to let the policymakers know it's not just as simple as getting a medication all the time. So we want reimbursement for the work that pharmacies do. We want bigger stockpiles in the wholesalers. And of course, we want policymakers to know that you need to have your pharmacists there in the broader spectrum of healthcare, but it's also about our own pharmacists taking the responsibility of doing their job properly.